This is Dr. Bradley Kopser, and I'm here to walk you through the guidelines, the different steps of the Structural Reset program. In this program, we're going to go through 3 different phases. The first phase is to reduce inflammation. Okay, it always starts with reducing inflammation. Healing can't start until inflammation is under control. So we need to get this done. It's going to take most people 10 to 14 days to achieve this first step. We want to do it without the use of any prescription or over-the-counter medication, so we can avoid all those nasty side effects. The second phase is then to move into the freedom of movement phase. In this phase, we want to restore range of motion to your joints and then your flexibility and extensibility to your muscles. So we got lots of great tips and tools to help you do that. Now in the third phase, this is the final phase, now we need to strengthen the muscles so that those first 2 phases are not just temporary. Okay? Nothing becomes permanent until we start strengthening, because that is really essentially programming your muscles. And we need to program them to be in this new healthy place. So we're going to start gradually, we're going to start slow and gradually work it up to a point where it can actually move into a fitness program as well. All right, today we're going to be covering the massage stick, so also known as a rolling pin. If you can't find a massage stick, you can actually use a rolling pin, but one of these are actually pretty easy to find online at a local sports store. Even Walmart has been known to carry these things. So they're pretty cheap, so pretty relatively inexpensive. Okay, so we're going to start with the lower back. Okay, so you typically want to do about 20 progressively deeper passes. So you start light and slowly increase. Discomfort or pain can be experienced when you find a bump or a tender knot in the muscle. Okay, this is a trigger point. Okay, so about 20 passes. Then we'll move on to the glutes next. Okay, going up and down there. Again, this is going to be wonderful for back and hip pain. Okay. If you have somebody at home that can help you with this, if you have a spouse or significant other that can help, then you can actually just lie on your stomach and have them do this for you. It's even nicer, but the idea that we're trying to teach people is to be able to do this for yourself. Okay, next we're going to go on to the quads and the IT band. So going straight up and down the front of your quadricep and the front of your leg. Okay. And it's also really nice for the IT band. This is something that we covered in the styrofoam roller section, but this is actually a little easier, especially when you're starting out, because you don't have to have your whole body weight on the styrofoam roll, and you get to start with a little lighter pressure. Okay, next we're going to move on to the anterior tibialis. This is the muscle in the front of the leg where a lot of shin splints happen. So this is a really great way to work out shin splints. Of course, this is after you have gone through the inflammation control portion of your program first. Okay, so just rolling up and down there. It's going to be great for your shin splints. Again, start slow and get progressively deeper as your muscles can tolerate. Okay, then we'll go to calves, right in behind the shins. And just coming up and back down there. If it's painful, just reduce the pressure. You don't have to rush into this. Okay, just take your time, and this is going to be a process it's going to be consistency over time. Okay, you're not going to work out all the knots in one session. Okay, they're always okay. You want to place enough pressure to create discomfort but not pain. If you feel yourself tensing or tightening, you're defeating the purpose and preventing the benefits. So make sure that you're not moving too fast, too hard, too fast. A little bit of redness afterwards is normal, but if a bruising appears, make sure that you let that bruising totally heal before you go to work on it again. All right, and you want to follow up your session with a little bit of stretching. All right, everybody, good job, and we'll see you soon. This is a continuation of the second phase of structural reset, freedom of movement, using the styrofoam roller. I picked out what I think are the 6 best star foam roller exercises, and Judy's going to demonstrate them, starting with the quadriceps. You're going to lie on the foam roller on your quads. Slowly work from your hip flexors to just above your knees. You can try turning your feet in so that you're pigeon-toed, or heels together to target different areas of the quads. When you hit a hot spot, try bending the knees to get a little deeper. You want to do this for about 2 minutes to 5 minutes to begin, and slowly, gradually increase the time and the intensity of your body weight. Next, we're going to go on to the IT band. The IT band, or iliotibial band, is a long series of connective tissue that runs down your outer thigh like the seam of your pants. I think this is the most challenging body part to roll, but you're going to start by lying on your side on the roller, beginning at your hip. Slowly roll from the hip to the knee, being careful not to roll over the knee. Keep your legs straight and remember to breathe. Next, we're going to move to the piriformis. Sitting on the roller with one leg crossed over the other in a 4 square stretch. You're going to shift your weight into the stretched leg and roll. Or if it's too painful to roll, you can just hold and breathe. This is a tender area for a lot of people, but it's an important area. This is going to help with any low back or hip issues. Okay, today we're going to look at a great handy trigger point tool that we can use called a tennis ball. Okay, and this can also be a golf ball, but today we are going to use a tennis ball. Golf ball is kind of when you're more advanced and you can really tolerate deep work. The tennis ball is a better starting point. So these are great tools for trouble areas that are away from the spine. So I'm going to have Judy start with her quads, upper quads, and right into the hip flexors. So what you want to do is you can use your body weight to adjust the intensity that you want to use, and just roll around on that ball until you find a spot that you feel is a good key spot, and we call that a trigger point. And when you find it, you can stop rolling and just hold on that spot and take some deep breaths. Let yourself just relax into that. Okay. Another good place to use a tennis ball is in the glutes. So the glutes are a very important area for hip pain and lower back pain. So just rolling around on there. You can do it either in a seated position or lying down, whichever is most comfortable for you. And again, roll around till you find a key area. When you find that spot, just let the ball do the work, let your body weight do the work so that you can just relax into it. Okay, and as I previously said, once you feel like you've exhausted the benefits of the tennis ball, you can use a golf ball for a little deeper pressure. Great, thank you. This is step 3 in Structural Reset, the strengthening program, starting with the body ball exercises. We're going to begin with crunches, lying on your back. The ball is placed on your abdomen, hands on the front top portion of the ball. Come up, bringing your chest to your abdomen. When you come down, do not let your head touch the ground. Repeat 16 times, pushing harder on the ball to generate more resistance for your abdomen. Breathe out when you come up, breathe in when you come down. Next, we'll go on to obliques. So now we're going to come up, roll the ball over to the outside of your knee each time. Once again, 16 repetitions, blowing out when you come up and breathing in when you come down. Next, we'll move on to hamstrings. the bridging. This is the easiest way. So the beginner way is to have your feet on the ground and then just raise your pelvis off the ground, hold for 5 seconds and lower. The first advanced version of this is to put your feet on the ball, mostly with your heels making contact, and lift your pelvis off the ground. You can bring your arms on the ground beside you, but if you want to make it more difficult, you can lift your hands off the ground up into the air, and this is going to create more stress on your core and your stabilization muscles. The third progression is to raise one leg off and then raise your pelvis up. Hold for 5 seconds, lower down. Then you'll repeat on both legs, 8 times on each leg. Next, we're going to move on to the ball squeezes. So bringing your ball in between your knees for the adductors and part of the core workout. You're going to squeeze your knees together and relax. Hold for 5 seconds. Make sure you tighten your buttocks and relax. You'll do 16 repetitions. The more advanced version of this is sitting on top of the ball with the ball placed between your knees in an upright position, and you're going to squeeze the ball and hold again for 5 seconds and relax. Next, we're going to move on to abdominal curls, lying on the ball. Find your center of gravity with your back on the ball, hands behind your head or by your side, and just crunch up, bringing your chest up towards your abdomen and lower. When you lower, don't lower all the way back, just about halfway back. That way you keep the stress on the abdominal muscles without giving them a rest. There's different variations you can use with your hands to make it more easy or more difficult. Having your arms out like this position will make it easier. Hands behind the head will make it harder. Next, we're going to move on to back extensions. So you're going to turn over so that your abdomen is on the ball, and you will need to place your legs or your feet up against the wall so you can stabilize them. The first version of this is to keep your knees on the ground and lift your torso off the ball. Hold for 5 seconds and repeat. All the ball exercises are 16 repetitions, so this one is the same. For a more advanced, difficult version of this, straighten your legs so the knees are locked out. And again, lift your torso up, hold for 5 seconds with your pelvis on the ball. Next, we're going to go to the leg part of the program. That concludes the core exercises. Moving on to the leg exercises, we're going to begin with hack squats. Place the ball on the wall behind you and lean up against the wall. In the hack squat position, the legs are far apart with the toes pointed out. We're going to begin with a half hack squat, so just lower down halfway and come back up. We'll repeat this 16 times. For a more advanced version, you're going to go full hack squat all the way down and come back up. Again, repeating 16 times. Next, we'll go on to squats. Squats are both feet straight in front. You're going to lower down and return coming back up, rolling up and down against the ball. Again, 16 repetitions. And for a more advanced version, lift one leg off the ground and lower just using one leg. Again, repeat 16 times each leg. Next, we have the leaning calf raise. So you're going to lean forward, turning your torso around so that your body is facing the wall. And you're going to lift up on your calves and lower back down. 16 repetitions. The more advanced version of this is to lift one leg off the ground. You can place it behind your other leg and lift up 16 times on one leg. And that completes our ball portion. Make sure that you repeat on both sides, and we are done.